Hello, my name is Kristel Bustamante, and today I'm going to talk about Spur-Cell anemia. First, definitions. Spur-Cell or acanthocytes are large erythrocytes covered with spike-like projections that vary in width, length, and distributions. Spur cells can be encoded in acquired or inherited disorders. Perceive the video number 1.
Better understanding of the material. So to learn from the best USMLE review book, be sure to check us out. Acanthocytes in human biology and medicine refers to a form of red blood cells that have a spiked cell membrane, and this is due to the abnormal thorny projections. These cells are also referred to as spur cells. What does the word acantho mean? The word acantho means miny. Name some conditions in which you would see acanthocytes. You would see acanthocytes in conditions such as liver disease, as well as an A-beta lipoproteinemia, which is a state of cholesterol dysregulation. What is basophilic stippling? Basophilic stippling refers to an observation found when observing a blood smear in which erythrocytes display small dots in the periphery. Name some conditions in which you would see basophilic stippling of the RBCs. You would see basophilic stippling of the RBCs in conditions such as thalassemia, anemia of chronic disease, and lead poisoning. What is the mnemonic to help you remember that basophilic stippling is seen with these conditions? The mnemonic is base the ox tail, and tail stands for thalassemia, anemia of chronic disease, and lead poisoning. For more information on this topic,
Okay. Spur cells are characterized by diminished deformability, which is responsibility for their entrapment and destructions in the spleen. Historical spur cells anemia has been described with advanced alcoholic liver cirrhosis, but it can also be observed in other severe liver disease. The inherited disorders associated with significant acanthocytes are characterized by associations with neuromuscular disorder. Prognosis. The prognosis of Spur-Cell hemolytic anemia is advanced liver disease is poor because frequently the conditions preceded by a few weeks to months. Most patients die of gastrointestinal bleeding, hepatic encephalopathy, or sepsis. Patients with a beta lipoproteinemia develop functional deteriorations early in life and do not survive beyond the third decade. Spur-Cell anemia in severe liver disease. In Spur-Cell anemia, the hemoglobin level usually falls to less than 10 grams per deciliter, and occasionally to levels as low as 5 grams per deciliter. This fact may be associated with severe jaundice and rapid deterioration of liver functions, coagulopathy, and hepatic encephalopathy. The course of Spur-Cell anemia correlates with the liver functions. Case of reversal of the hemolytic anemia have been reported of improvement of liver disease. Spur-Cell anemia has been reported in case of pediatric cholestatic liver disease. In most cases, the condition is transient and resolved with the improvement or underlying liver disease. Application in medicine. Anemia can be corrected by red blood cell transfusions, However, the transfused cells became acanthotic with shortened lifespan in the circulations. Patients with acanthocytitis should abstain from alcohol use. Abstinence from alcohol use may result in the nearly complete disappearance of or acanthocytitis in the peripheral blood. In patients with mild to moderate alcoholic liver cirrhosis, abstinence from alcohol is also the best preventive measure for the Spur-Cell anemia. Here's the video number 2.
In the previous video, we have discussed echinocytes or Burr cells. Today, we'll talk about acanthocytes or Spur cells, an abnormally shaped red blood cell. Where did the word come from? From an ancient Greek word called akantha, meaning thorn, like these thorns. Site means cell. So acanthocytes or Spur cells, they are red blood cells with spiked membranes, abnormal membranes. They have coarse, variable sized projections at variable distance from each other, okay? If you remember the previous video, echinocytes, these projections were smaller, more numerous, and they were at equal distance. But here, acanthocytes, variable distance, coarse, and variable size. Okay, when do we see acanthocytes in the blood? Please don't forget A-beta lipoproteinemia, which is a rare autosomal recessive disorder, deficiency in apolipoprotein B48 and B100. There's a problem with chylomicrons and VLDL. Okay, what else? Liver disease, McLeod syndrome, chorea acanthosis, neuroacanthosis. They're very rare diseases, but please, if there's anything that you can learn from here, A-beta lipoproteinemia, they have acanthocytosis. Is the pathogenesis of these cells alteration in membrane lipid or membrane protein of the red blood cell? Sometimes in cases of severe liver disease, these acanthocytes will go to the spleen. The spleen will try to make them more round or circular, and this is called spheroacanthocytosis. Thank you for watching.
Okay. Next, pros and cons. Pros: a blood and bone marrow transplant is currently the only cure for Spur-Cell anemia, and only a small number of people with Swinkel cell disease can be received the transplant. There are effective treatments that can reduce symptoms and prolong life. Cons: blindness, mental deteriorations, loss of peripheral nerve functions, uncoordinated movement. Here's the video number 3.
If you have anemia, your blood does not carry enough oxygen to the rest of your body. The most common cause of anemia is not having enough iron. Your body needs iron to make hemoglobin. Hemoglobin is an iron-rich protein that gives the red color to blood. It carries oxygen from the lungs to the rest of the body. Anemia has 3 main causes: blood loss, lack of red blood cell production, and high rates of red blood cell destruction. Conditions that may lead to anemia include heavy pregnancy, ulcers, colon polyps or colon cancer, inherited disorders, a diet that does not have enough iron, folic acid or vitamin B12, blood disorders such as sickle cell anemia and thalassemia, or cancer. Aplastic anemia, a condition that can be inherited or acquired. And G6PD deficiency, a metabolic disorder. Anemia can make you feel tired, cold, dizzy, and irritable. You may be short of breath or have a headache. Your doctor will diagnose anemia with a physical exam and blood tests. Treatment depends on the kind of anemia you have.
Okay. Next. Conclusions. Acanthocytes, also called Spur-Cells, are speculate red cells. They depend on the alteration in the lipid compositions and fluidity of the membrane. Acanthocytes is a phenotype of red cell found in several conditions. A beta lipoproteinemia and in hemolytic anemia with several liver disease, mixed edema, and pan-hypopituitarism are the most frequent clinical situation in which we can see acanthocytes. It is also seen in the neuroacanthocytes in anorexia nervosa and in other malnutrition states. Thank you.